I'm a physical therapist and I need to tell you something a little uncomfortable. Most physical therapy for hip pain doesn't work. Not because physical therapists are bad at what they do, but because the system they work in is not designed for the kind of chronic pain that you are dealing with. It's just designed for more kind of acute injuries, like short-term problems, quick fixes. And until you understand that difference, you're going to keep going in the same cycle, going to PT, feeling a little better, then you get discharged, and then you're ending up right back where you started. So in this video, I want to walk you through exactly why traditional physical therapy hasn't fixed your hip pain. I'm going to show you what it misses and what keeps you stuck and what actually needs to happen if you want real lasting change. Most women I talk to have already done physical therapy, not just once, but usually 2 or 3 times. They followed the plan and they did their exercises. They really showed up. And maybe they even felt better for a while, but now they are sitting there wondering if something is seriously wrong or if their body just cannot be fixed. My name is Marit. I'm a physical therapist and I've spent over 20 years working with women with acute pain and women whose hip pain did not resolve with traditional approaches. And I see the same pattern over and over again, like same exercises, same short-term results, and really a lot of frustration. So let's break down exactly what's going on here. So the first thing is that traditional physical therapy treats your hip like it's an acute injury, but your hip is not an acute injury. Any pain beyond 3 months is considered chronic pain. So if you sprain your ankle, there is inflammation and swelling and a clear healing timeline for it. You go to PT, you reduce inflammation, restore the motion, and in a few weeks you're done, feeling better. That's what the system is built for. But chronic hip pain is completely different. This is not one injury. This is months or years of your body moving the wrong way. Your pain is not just inflammation, it's a result of repeated stress from faulty movement patterns. So what happens? PT reduces your inflammation. You feel better, but no one actually fixes why your body keeps creating that stress and pain in the first place. So you go back to your normal life, same movement patterns and same compensations, and boom, the pain comes right back. It's like you're fixing water damage in your house, but you're really never fixing the leaking roof. It looks good for a moment, but then the next rain, the damage returns. So I want you to think about your experience. Did anyone actually break down how you walk, how you stand, how you move? Or did they focus on pain, flexibility, and strength in isolation? Because if they didn't look at your movement, they didn't fix the root problem. Now, here's the second issue. Most physical therapy is limited by insurance. That means that sessions are shorter. They are usually about 30 to 45 minutes, and often therapists are kind of juggling with multiple patients at the same time. So you need to be observed walking, moving, shifting weight, using your body in real situation. And if you experience more pain after the session, finding time to figure out what happened is impossible. And that doesn't fit into a rushed appointment. So what happens is therapists do what the system allows. They do manual therapy, they do those standard exercises, protocols, stationary biking, not because they don't care, but because they don't have time to go deeper. It is like go to a mechanic who has 30 minutes to fix your car while working on 2 others. They'll do something that's helpful, but they won't have time to fix the real issue. So think about your sessions. How much time did they actually spend analyzing your movement? Like not talking, not giving exercises, actually watching and assessing what is going on in your body. Because if that time wasn't there, the plan wasn't built around you. And if you're starting to see why traditional physical therapy hasn't worked for you and you're ready to actually understand your own body on a deeper level, I put together a free webinar where I walk through how to identify what's really driving your hip pain and what to do differently. You'll find the link below. And also, if you find this information helpful, please subscribe to my channel so you can stay up to date on all videos that I will be making weekly. The third problem that most people get is that they get a standard program. If the diagnosis says hip pain, you get a hip pain routine. So this is hip flexor stretches, it's clamshell, glute work. Those exercises are not bad, but they are just very generic. And your problem is not generic. Your hip pain has a very specific reason. So maybe your pelvis spins over the femur, the hip bone, during walking due to poor muscle control. Maybe your femur is sitting forward in the socket and creating pinching in the groin anytime you try to walk or bend your hip. Or maybe your core isn't stabilizing your pelvis. Maybe one side of your pelvis is rotated forward. But if nobody identifies your specific issue, then your exercises are just gonna be guessing. And doing the right exercise at the wrong time or for the wrong reason in the wrong form will not fix you. So ask yourself this. Were your exercise based on something unique they found in your movement? Or were they just, giving you hip exercises? Because that difference really matters. Now, here's where it gets important. Your hip doesn't hurt because it is just weak or tight. It hurts because how you are using it. So most PT focuses on improving strength and flexibility around that hip, but they don't always connect that to a real movement. So let me give you an example. So you can have strong legs and still have hip pain because if your pelvis is not supported when you walk, you're still loading the joint in an unhealthy way. So here is an example. I had one client who had done 12 weeks of physical therapy, and she was very athletic. She was strong, super flexible, which might be a problem there. Everything looked great on a paper, but she still had lateral hip pain, like on the side of the hip when she was walking or working out. So when we looked at her movement, her femur was in an internal rotation and pelvis in a big anterior tilt. That created constant pinching in the groin and the outer hip pain. So we didn't need more exercises. What she needed was to address the pinching and the pain from the alignment perspective, not just hammering those big exercises, because what's worse than trying to build strength on the top of a poor alignment? And 3 weeks later, her pain was gone. But that's when we started talking about bigger movements like, let's do squats or lunges. So that's the difference, not just training your muscles for the random strength, but changing the alignment, then retraining on how your body actually uses muscles. And the last piece, this is a big one. So you get discharged when your pain is better, but real life hasn't even started yet. So in the clinic setting, everything is kind of controlled, but then you go back walking, stairs, workouts, daily life, all that jazz. And if your movement patterns fall apart under those demands, the pain comes back because nobody taught you how to progress yourself. Nobody showed you how to catch those patterns that create pain early. So what I teach to my clients is simple. Watch your movement, understand what is going on in your body, and pay attention to how you walk, how you hinge, how you stand up and sit down, and how your body reacts to the activity during the day. Because the goal is not just to feel better in a clinic after a hands-on treatment. The goal is to move well in real life without thinking about your hip constantly. So here's the truth. Traditional physical therapy is not broken, but it's just isn't designed for chronic hip pain, and it just treats symptoms, not the whole body as a system. It works short term, but it doesn't go deep enough to create a lasting change or improvement. If you want to fix this, you need to understand your movement, your alignment, and how your body is actually functioning. And that's where the real change happens. And if you're ready to stop guessing and finally understand what's going on in your body, go watch my free webinar. You'll find that link down below. I will break this down step by step and show you exactly what needs to happen to get out of the pain cycle.